Hi, this is Mark Newman, founder of Precision Analytical, the makers of the Dutch test. And in this video, I really want to unlock some advanced concepts from our new report format for the Dutch test. You're going to see this fantastic new hormone testing summary page that we've explained in detail in other videos, but I want to really unpack some of the more advanced concepts in this video. Now, what you'll see with this new format is that we've got the 12 key elements for a Dutch test pulled onto this summary page. And what we've explained in other videos is the education that wraps around these 12 concepts. We're calling it the Dutch dozen. We've got four key elements for the estrogen story, the androgen story, and the cortisol story at a basic level to help you and your patient understand the basics of the Dutch test. But now we want to dig a little bit deeper. So the first element is estradiol. As we look at estradiol on the summary page, we can see for this patient that the estradiol is on the higher side of normal, but there's a deeper story to be told when we get to page 2. So we can see estradiol, but we can also see two estrogenic metabolites, E1 and 16-hydroxy E1. These both have less estrogenic impact than estradiol, but more than the other metabolites. So in a case like this, where estradiol is on the higher side and these metabolites are on the lower side, that's going to be a little bit of a different case when compared to a patient like this that might have these metabolites not only on the higher side, but some of them even higher yet, which is going to exacerbate that higher estrogen that you see on estradiol. So we're enriching the picture that we learn about for this patient in terms of their estrogenic status. That's the question we're trying to ask here by looking at estradiol. And as you dig deeper on page 2 and look at E1 and E3 and 16-hydroxy E1, the advanced insight section of the comments that follows the Dutch dozen is going to help walk you and teach you through these comments with patient specific comments so that you can understand these concepts at a deeper level. That's number one. Number two is progesterone. So for progesterone, we want to know how much you make. That's the key issue that we see in the Dutch dozen. In the advanced insights, we're going to look at another concept, which is how is progesterone being processed and metabolized. You can see in this particular case, it's pushing more towards, while within range, it's pushing towards at the 74th percentile, it's pushing towards the 5-alpha metabolism, which means progesterone's pushing towards its more active sedating metabolite of allopregnanolone. We know that's going to be most relevant for you for your patients that are on oral progesterone. But again, we're opening up a deeper concept with progesterone. So for the four elements related to estrogen, estradiol, progesterone, phase 1 metabolism, and methylation, we're going to open up a deeper understanding with the advanced insights. And you can look at an example of that here and see that towards the back of our new report. Moving on to section 2, I'll just show you one example here of one of the concepts we can see is in the Dutch dozen, we can see adrenal androgen production or total DHEA production, which in this case is right in the middle of normal at 1686. But what we know is that number comes from three different metabolites, DHEAS or DHEA sulfate, androsterone on the lower right, and etiocalanolone on the lower left. A case like this, we're going to help you unpack of the things that can lead to a pattern of relatively higher levels of those two bottom metabolites and lower levels of sulfation or DHEAS. That's going to give you a more complete understanding of your patient's androgen metabolites, and so on with the other three elements from that summary page. We're going to unpack each of those at a deeper level. Similarly, when we get to the third section of the summary page, the cortisol story, cortisol, as an example, has an advanced insight looking at the inactive cortisone. So when we look at a case like this, being a Dutch complete, and on the right, you can see the cortisol is low normal on the lower side, but the cortisone is significantly higher. That's meaningful. And we're going to help unpack that in those advanced insights. So as you get to each section of the report, again, the Dutch dozen is going to give you a really nice basic understanding of your patient's hormones. And as you explore those advanced insights, the comments there that are going to be patient specific are going to help you understand even more about the Dutch test and your patient's hormone results. Additionally, take advantage of our Dutch interpretive guide, our mastering functional hormone testing courses, as well as other courses and group mentorships. And as always, our clinical consultation team stands ready to help you to leverage each Dutch test to help each patient on their journey towards hormone health.